As thousands of Ontarians struggle to find a family doctor, those lucky enough to have one are facing a new problem, being cut from their physician's roster. As Tina Yazdani reports, unmanageable caseloads are leading some GTA doctors to a painful cure.
I was quite shocked because I've been there for like over 25 years.
Claude Silvera's family doctor in Brampton unexpectedly withdrew their services. In a letter, his doctor wrote, "It is with a heavy heart that I must inform you that as of February 1st, 2023, I will no longer be able to serve as your family physician. Due to personal reasons, I will be decreasing my patient roster size and working hours significantly. If you are receiving this letter, then you have been selected randomly for termination."
I cursed because I know how difficult it is. I know people who don't have GPs, and I've been so lucky my entire life. I've always had a GP. And I was like, oh no, now I'm one of those people that have to go to walk-in clinics all the time.
He was surprised to see multiple people from across the city posting online that they were in fact in the same situation. It is contributing to a growing problem. As of right now, the College of Family Physicians of Canada tells us 5 million Canadians are without a family doctor, including almost 2 million here in Ontario.
We're seeing burnout at rates that we haven't seen forever.
And Dr. Newton is not surprised to hear some physicians are decreasing their practice size.
And some of our practices have gotten quite large. Meanwhile, patients are living longer. And as they're living longer, they're getting more things. And as a result, we can't manage as many patients as a decade ago.
According to the College of Physicians and Surgeons of Ontario, when reducing a practice size, physicians must exercise professional judgment to select which patients to remove from the practice, employ a method of selecting patients that is fair, transparent, and compassionate, take into account the medical needs of each patient, and consider any other relevant factors, including the patient's vulnerability and the patient's ability to find alternative care in an appropriate time frame. Physicians must not selectively or disproportionately discharge difficult or complex patients.
It definitely puts pressure on our hospital system further downstream. It definitely puts pressure on our emergency rooms.
He says more emergency room physicians are seeing patients come in for routine concerns.
Everything is interconnected, and we often see people coming into the emergency room who need to be admitted because unfortunately they could not get an appointment with their family doctor because the wait time was too long, or they did not have a family doctor and they needed a medication adjustment, they needed some blood work and some monitoring, which could be done in primary care, but unfortunately it just didn't happen because of these access issues.
The Ministry of Health tells us since 2018, the government has added more than 1,060 doctors in family medicine. For CityNews, I'm Tina Yazdani.